Junior doctors and consultants are staging their first ever joint strike in what industry leaders say will be the biggest challenge to the NHS yet. Hospitals have put in place Christmas Day-style rotas. That means they'll respond to emergencies, but thousands of operations and appointments have been cancelled. Members of the British Medical Association say they'll carry on striking until the government makes a credible pay offer.
We're here because we feel that this is really important. None of us want to be here today. It's unbelievable to me that that I'm actually stood outside my hospital when I could be inside doing work, because all of the colleagues that are outside on the picket line or who are not at work today would far rather be in work treating our patients.
We feel if we don't address the real terms pay cuts over the last 15 years, that doctors won't want to work in the NHS in the future, and we feel the government really needs to address this critical problem.
We're sorry for contributing a tiny amount to the size of those waiting lists, but the reason we're here is because of the waiting lists and because of the ambulance waits and because of the waits in A&E. So unfortunately, the government isn't listening.
Joining me live now, Professor of Political Economy, Ashok Kumar. Ashok, thank you for joining me. I mean, an historical strike where the consultants, who are, obviously the best paid and most senior staff in the hospital, are on strike alongside the junior doctors. It's a really big deal. We've never seen anything like this before, this kind of level of collaboration of a strike from junior to senior all at once. And of course, as we know now, the effect on waiting lists and on routine care and on patients is pretty monumental.
Well, like the last person that spoke suggested, often you have people pointing out, and like you said, this is really unprecedented, because you're seeing across the board, we had nurses strikes, we had doctor strikes, we had junior doctor strikes that were ongoing, we have now consultants and coordination. So it's affecting the entire sector. And yeah, a tiny amount is being contributed to the waiting list because of these strikes, but actually the much larger issue, 7.5 million waiting list for treatment, 1 in 7 across the country, that existed prior to the strikes. 500 people dying every week as a direct result of that. So I think part of the demand is actually very much to stop this shortage.
And we have this some people will say unwillingness on the part of the government to, using the classic phrase, get around the table and actually talk about this. You have the government saying that the demands of the junior hospital doctors are astronomical and completely kind of in the realms of fiction and fantasy. It can't possibly be fulfilled. There's nothing to say around the table. There's no point sitting around it with them. And we don't really know where we're going with this. But what we do know is we've got an uptick in COVID. We've got winter looming. There's always the threat of winter flu and all the sorts of, plagues and agues that ail us when the weather gets cold. And it's a frightening prospect. Plus, I have guests on this programme every 5 minutes saying the NHS is broken, the NHS is broken. I mean, I don't know where we're supposed to be going at all with this, do you?
Well, look, I think it's very clear that the NHS, there's severe problems in the NHS. Like you said, get around the table. The fact that the government is refusing to even meet the doctors is pretty much an indictment. It seems like they just don't seem to care. The 35% is a restoration to 2008 levels because they've been sinking 33, in a year's time, we 37% cuts below in real terms fall since 2008. So it's a restoration of pay. So it's not this outlandish demand. It's outlandish that they've had to see this many cuts. And, 160,000 staff shortfall, that's a significant amount. And even the government's own figures say that if things continue the way they are and there isn't dramatic changes, within 12 years, that number will reach 360,000 people, 360,000 shortfall in the NHS staff, which will mean more, 2.5 times as many deaths potentially per week because of the waiting list. I mean, who knows? It's incalculable how much misery this is going to wrought on the British public. But the demands they're making aren't really crazy. They're not outlandish. If you look at other countries, doctors here make 30% less than Western Europe. I'm not talking about consultants. I'm talking about junior doctors. 50% less in Australia or New Zealand and Canada. They make twice as much in Ireland and the US. Similarly, compared economies are paying much more. So doctors are leaving. Like if we take any other part of the economy, let's say companies, we're saying, corporation tax is too high in Britain, we're going to leave. You'll see every single government, every single major party, every single institution saying, we have to reduce corporation tax. But for some reason, when doctors and nurses and consultants and others are fleeing the country and there's a real crisis in the NHS, nobody in the power structure is suggesting increasing their pay.
Is it possible that at some juncture, and I'm saying the unsayable, I'm saying what nobody ever wants to say, nobody ever wants to think about, nobody can bear to contemplate, but is it possible that at some juncture we are going to have to consider that it is impossible to provide this nation with a health services as a health service that is free at the point of service, that we just can't afford it. So therefore, charges will have to be made. And this terrible phrase that people dread with good reason, the privatisation in part or infraction of the NHS, is inevitable. So, for example, let's imagine you have a hospital stay. Let's imagine you're having a hip replacement. Let's imagine that instead of getting your food free, your laundry done free, you know, all the sorts of things that happen when you stay in hospital that you don't have to pay for. But if you were at home, you would have to pay for. You'd have to pay for your food. You'd have to pay to wash your sheets. You'd have to pay for many, you know, light, heat and rent. That you would be charged a kind of admission fee. You'd be charged for the washing of your sheets, charged for the cleaning of your room, and it would be somehow means tested or whatever it is, and people have to start paying because as a country, as a nation, we can't afford to fund this. I know this is appalling and people can't bear to even consider it, but is it inevitable that that sort of thing's going to happen?
Well, this is the problem. Since 2010 or even before that, you know, there's been an ideological push, and I understand what you're saying, Vanessa, but to make it so that they make such drastic cuts to the NHS, which was a prized institution, that people say, oh, we have to privatize it. I'm from America. I've seen what privatized healthcare means. It means 80% of all bankruptcies are health related. It means that 1/6 of the entire economy is spent on healthcare costs. It goes into bureaucracy, it goes to profits, it goes to hospital profits, it goes to HMOs. So the most wealthy institutions in America make money off of misery and death and disease. The fact that you think that that privatization will somehow, and I know you're not suggesting this, you're just putting it out there, is that we can't afford it. Profits in this country, in the S&P 100, are through the roof. Executive pay has increased 40, 50% in the last year. Why can't we afford to tax those people and have a affordable or an actual free public healthcare system? Private healthcare hurts the poor. And it means that basically if you start these fees programs, it's like tuition fees. In 1997, New Labour came in and said, we just want a small little fee to go to universities. Now we have the most expensive public education in the world. So, and people have to take mortgage-style debts to go to universities now. So it never starts off as a small fee. The small fee is just a little aperture, and then it opens up, and everything starts being charged. And once you let the private sector in, their greed is insatiable, and it'll basically cannibalize the entire NHS.
Well, God, that was an enormously epic response to a very minor suggestion there. Cannibalisation, utter destruction, total annihilation, bankruptcy and everything else. I think some people will think that when you're in hospital, you would have eaten at home. There's no reason at all why you shouldn't pay for the food that you eat in hospital. And that would be a start. You would have to wash your sheets at home. You'd have to pay for it somehow, whether you had any money or whether you didn't. So if you paid to have your laundry done in hospital, that would be a very minor start. I think lots of people will think that cannibalisation and utter carnage and general chaos and anarchy might not be the result of something as small
I'm not saying
as
anarchy.
that.
I'm saying
but
that's
it's a great pleasure having you on the show because you give such a vivid answer to such a tiny question.